Okay, fantastic. Ladies and gentlemen, well, good evening and welcome to the late one with yours truly, Sylbourne. I want to thank you so much for joining us this evening on the late one in review, where we look at the top news and review some of the great things which have been happening. I tell you, one of the things which I've seen is that we've been trying to find some ways how we can get some different news on some different things. Well, we can say that China somehow had banned the BBC World from broadcasting news. We can see that Meghan Merkel has won a privacy, won some money from the privacy damage, and it runs deep. Yes, there's still COVID, and what we're seeing is that a year-long routine surgery wait like worse since 2008, and we got to go across to the States, whereby Trump lawyers are saying the Democrats are making movies. The Democrats are making movies. And, the biggest news that I believe really of this week is whereby in court in Texas, there was it's a pity I don't have it. There was a court hearing whereby one of the lawyers was actually a cat. And that was based on a filter. Now, I don't know who's going to be a cat today, but I know that today we had a big team meeting with my colleagues at the office, and most of the discussion was around cats. So without further ado, ladies and gentlemen,
ask yourself how many lives would have been saved, how much pain
and
trauma would have been avoided if he had reacted the way that a president of the United States is supposed to act.
Wow. Now, is David, is that you?
There are two parts of President Trump's failure here.
Who's that? David, is that you?
Dereliction of duty that I just have to emphasize.
Some powerful words there. Maybe you got an ex host on the show? Is that
I'm trying to see
to Vice President.
I'm trying to see where that is coming from. It's like I heard that the sound
Vice President,
the sound of
United
God
States of America,
coming true.
His own Vice President.
His own Vice
in
President
this building with an armed mob shouting, "Hang him!"
Wow. Can we hear that still?
I can still hear it. I don't know where it's coming from. But somebody's trying to.
Saw those pictures.
Did we got hacked?
Basically, feed into your show.
Yeah.
It's interesting. Is it stopped? No, it's still going.
He singled him out by name.
Wow. I actually don't know where it's coming from.
Honestly.
So obviously the topic of discussion today is going to be about Trump.
There it is. Is it gone? Okay.
It's gone.
Okay. Well, that seems to be that seems to going to be one of the main topic of this evening, So anyhow, guys, how are you doing?
All good.
Yeah. Hey, how are you doing? Keisha, Keima?
Hello.
Well, I just got hijacked a while ago about some voices. I thought it was from heaven or so. But
no, I thought it was weird as well. I was thinking, what's happening?
Yeah. But I think it was a good way to start the show, David, isn't it?
I think so. Why not start with a bit of Trump? We need some entertainment.
So you're trying to say that there's a lack of entertainment of these last days, David?
I'm not going to be led down a garden path here, but I'm going to retract and just say, look, there's always entertainment to be had when you look across at the States for the past 4 years, and it seems like it's going to be over in the next week at least.
Over in the next week, is it? So what we'll do? They will removing the president then. Right,
removing a president.
The president. Keisha, is Keisha there?
Yes, I'm here.
Okay. Anyway, Keisha, first of all, how are you? How's your week? That's fine.
Great.
It's great.
Yes.
You look a bit in a pensive mood. Did you? Are you okay? Yeah.
I'm okay.
Okay.
Staying indoors.
Okay, staying indoors, keeping the program. And David, how are you?
All good. Busy week as always. But yeah, good. All good.
Yeah. Keima.
Well, it's very good week. I mean, it's been snowing quite a lot the last couple of days where we've been. So it's great. So I stayed in for full 3 days while the snow was just dropping on the car, and then of course it was all about scraping off because I had to go out today. So it was good to venture out, but you've got to be so careful, of course, on the ice. But yeah, it felt good just going outside.
Well, I made sure that I spent a lot of time walking in the snow. Today I didn't go in the snow to do any of my motivational walk because I actually dreamt that I fell. the night before.
Okay.
And that's
Wow.
why I stayed in. You know, I know we meant to all stay in, but that's why I didn't venture out, because I'm kind of like thinking, I don't want to slip. I don't want to slip.
No, literally, David, I dreamt that I fell. So I said, let me just not go today.
But surely it's always a contrary. If you realize you're going to dream, you dreamt that you're going to fall. You're not going to fall. You
Yeah,
put your little
fall.
boots on. You're going to be fine. You won't
Well,
slip.
I was slipping and sliding the other day, and I said, let me just don't go the long walk, which I normally do, and I just turn back around and stay within the safety of the paramount, you know. But listen, one of the things that I saw today in the news, David, and you can pick up on that, is, of course, we're talking about COVID still, but it's this point about that there's been since 2008, the year-long routine surgery wait is worst since 2008.
Yeah.
You know?
I think we're not going to touch on COVID too much, but you can see the reason and rationale that I've week on week talked about the fact that there are other things that we should be concerned about.
Yeah.
There are other conditions we should be concerned about. And yes, COVID is there, but it doesn't mean that all of the other health problems disappear because of it. I've encountered personal kind of tragedy in this regard, and I'm sure people can account for and test for this in regards to their circles as well, where a delay in diagnosis has ultimately led to the death of a person that I know personally. And I'm sure we've all got our stories, and in that regard, it was a cancer diagnosis, and the treatment wasn't afforded to this person in a timely manner because of the distraction of COVID. So it's something that we all should be aware of. I think I've always said, if you've got a health problem, it needs to be looked after. You can't have COVID be the excuse for not looking after it. And if you're having new symptoms, you need to make sure that somebody, a healthcare provider, is aware of it. Tell your friends, tell your family. They'll give you the same advice. You need to seek assistance if you've got a health problem. You can't pause it just because COVID is there and out there. Because what we've done very effectively in the NHS is essentially allowed for safe passage of patients to come into hospitals.
Yes.
People who in our eye clinic, for example, they're very, very safe. We have they're very well safe from other patients. We have screens that divide them up, and when they come in for a period of time. They don't have the relatives that would come in there for a long and short of it. They come in to have their assessment. The assessment rooms are cleaned before they come in the room, cleaned after they come in the room. This sort of practice is going to be carried out across the NHS. So it is very important that people do come in for and the hospital's open for business. But the flip side is, yes, you're quite right. The report out today is showing that we've had to cancel a lot of procedures in the NHS up and down the country because of COVID, and we've got to really come to a way of dealing with that. And it's a really difficult challenge to sort of broach, because at the end of the day, there's lots of different persons who have had to work throughout this horrible year that we've had, and have not had a break, and are coming close to breakdown in terms of how they feel. And I say breakdown, I don't mean sort of a depression or anything like that, but what I mean is the want and desire to have a relaxed time. It's quite difficult and challenging when you're dealing with health at the end of the day. And so, there's that need. There's a need for patients to be seen in a timely manner. We've got to be thinking about how best to manage that situation. It doesn't all boil down to money. It does boil down to politicians, to the leading names within the health professions, to sort of come down and come up with a reasoned plan as to how to best task it. Because at the moment, obviously, it's not working as effective as it can for people who are out there. People are desperate for health. People are desperate to come into hospital. And are desperate for information as to how they can get access to the elective conditions that or elective surgeries that have been deemed to be necessary for them. And we don't want people living in pain.
If I should say, because I said nearly 225,000 people in England have now waited more than 12 months for routine hospital treatment. Highest number, as they said. Planned knee and hip surgery. Knee and hip surgery, I notice a lot. We keep hearing a lot of that. What can be what can be the devastating impact of prolonging knee and hip surgery, David?
I just touched on it. The last thing I said was we do not want people living in pain. And these are treatments that can be afforded to people.
Yeah.
I wouldn't say simply, but in this part of the world, we pay our taxes. The NHS is there. It's there for people to sort of access, and it's not free, but it's there for people. And what I'm trying to say is that it's something that needs to be actioned, because people cannot be living in distress. It's a painful condition to be living with. And you think about the mobility of that. What I mean by that is you won't be able to move around as well. So if you're not mobilizing and moving around as well, you're not keeping yourself nice and fit. Then the drawbacks is that you're becoming unwell, and unfortunately you may well be picking up a little bit more around the waistline, and you're becoming succumbing more to other potential health conditions as well. So we need to get people active. Moving around, mobility is key to maintain life. We need to keep walking and moving. As simple as that.
Keisha or Keima, let me go to Keisha first. What's your take on this? If someone having like hip replacement, or do you fear going to the surgery or going to the hospital, if anything, if for any routine checkup? Now,
thank God I'm in good health, but if I was in that situation, I would be fearful. Just leaving my house right now is a concern to me. So
you would be fearful. Is that what you say? You would be fearful.
Yes, I don't particularly want to go to the hospital or go to the GP unless I really, really, really have to, and I don't have a choice.
Yes.
And even if I have an appointment, like I got a letter from my GP the other day to tell me I should come and do a flu vaccine, like the flu jab, and I'm weighing up thinking, do I really need that right now? I didn't think we could wait on that. We could delay that. That's not really urgent. So I'm leaving my house for a flu jab. I'm sorry.
Well, why is that? Why is that? Why is that? Why you don't want to go to the hospital for your flu jab?
Every time you leave your house, you're putting yourself at risk. So I've actually adjusted already. Maybe it's a mental thing, but I've already adjusted. If I need my food, I'll order from Tesco or the online provider. If I need anything for my house, I'll order from Amazon. I'm happy. I mean, I was smiling when David talked about we need to move about for our own health. And I'm thinking, well, okay, I'll just move from the kitchen to the living room, upstairs and downstairs of the house. Or at least I'll probably go to my garden. But the idea of actually leaving my house to go someplace, as in, unless I really, really have to, at the moment, I am struggling with it. Because I'm just more concerned about, this COVID virus that seemed to not, we're not getting rid of it at all. And I just want normality as soon as possible. So I can feel free to leave my house. At the moment, I feel safe indoors. So I think maybe the government, just a suggestion, David, should think about another way in which they can help people who are actually in, these terrible situations right now. So maybe you could have nurses like yourself, specialist doctors, who are more than happy to go inside and go and visit the, the sick and those people who actually are in need, go into their homes rather than having to, they're forced not forced, but then they feel uncomfortable leaving their home because of fear. The worst thing they want to do is to go and get COVID and die of COVID.
All right, let me pick up on Keisha, Keima, before I go on to David. And ladies and gentlemen, I say Keima and Keisha because they know that they are twins and we interrelate along the way. Yeah, Keima, what's your take on that? Because I'll give my experience of last week.
Well, I can understand. I'm not surprised with all the challenges people face, particularly people with hip conditions or cancers, and not wanting to. People finding themselves with a lump and don't want to go to hospital for a checkup because they're nervous. You hear so many stories about people go to hospital and they get COVID whilst in hospital. So I could see why people are just things like this. They're very nervous of actually going to hospital. So I don't know. I could understand it. But ultimately, I think people just need to take precautions and think of their own health. Of course, once you wear your face mask or, you sanitize and you make sure you stay away, you're 2 distance from people. You just need to be extra cautious when you're going out there, especially if it's to do with your own health. I don't think you should put it at a back burner and just be like, no, I'm not doing it. At least go and get it checked out. That's how I would see it.
Well, I'll give my experience, but before I do there, I want to welcome those on Instagram, those on YouTube and Facebook. Delora Stewart, blessings up to you. Lorna Foster, say good evening. Delora, say good evening. Herbert actually came in and just said, I think we're getting carried away. We can't allow ourselves to be living in isolation.
I think
And
that's what is for Keisha.
yeah, that's for Keisha. For me, everybody knows that I'm out every morning walking on the street and just, hanging around with the birds and everything like that and just having a good party and just saying, the world is there. We cannot be in isolation. But David, you know that I call you today because I got a letter because I've been diagnosed pre-diabetic, which is not on prescriptions or anything. And there's an eye test that I needed to do. They put something in my eyes, and I thought about it and I called David and said, what do you think? You know what I mean? And he said, yeah, go in there. And I just make sure I pad up and, put on my stuff, my gloves. And then I couldn't walk again. I couldn't drive. I had to walk because they say you have to walk because, if the thing is bad, it can affect your eyes. But then it was snowing as well. So I walked and I went to the hospital, but, went in there, empty. When I say empty, not empty hospital, but the section where I'm going, and sat sections. The doctor guy, the young guy, came out to me and said, Mr. Sidiel, there were 3 other persons there, all, socially distanced. And I did my stuff, David, guys, Keisha. I did my stuff. Walk out, and I'm here. No coughing, and then I got lost on my way back and ended up going through a crowd of people. I was like, oh my days, I don't want to go through this. You know what I mean? I wanted
That's
to go
the risk you have to take.
back section. But as Herbert said, we can't live in isolation. David, what's your take on that? Because what Keisha is saying is real.
I think it's a real feeling. I think there's lots of, I say lots, I don't know the number of people who would have that particular feeling about feeling safer in their home than being outside of their home. But it's a true thing, obviously, it's a true statement. But what I would say is this. You're not guaranteed to get COVID if you exit your house, okay? But living in fear is probably not the best thing for people to do, because at the end of the day, life needs to be lived, and there's got to be a way of doing things in a safe manner. And what I would say in regards to hospital services up and down the country, there have been so many issues in regards to people's senior management's want and desire for people who come into the hospitals not to pick up COVID. Yes. I think it's to patients' benefits to come into the hospital if deemed necessary. I'm not saying you come in for pick up a packet of crisp and buy a coffee or sit down and read a newspaper. No, I'm talking about real appointments that people need to come into. So there'll be an assessment that's been made in regards to the need and desire for patients to present to hospitals. Sometimes that will be by a telephone, for example. You can do a telephone triage over the phone and ask patients questions that way around about their complaint. But sometimes, other times, it's going to be a need, like Sylbourne just said there, to go into the hospital because assessments need to be made, pictures need to be taken, and a diagnosis needs to be made as well. And whilst I think it would be a very nice system for clinicians, for nurses, for people to go into the community, to go into houses specifically, you can see that it takes a lot more resource than it would do for patients to come into a hospital, which is deemed to be a safe environment. Because how do we know that the environment that we're walking into in the home is safe in itself? Very tricky one to sort of assimilate that for every single person that you're going to go into the house for. So whilst I think it would be a nice system for us to have, we just don't have the man or woman power to sort of give rise to that as a modality of going about things. But I will speak for the NHS and I will say that it is a safe environment for people to walk into. It's going to be akin to what Sylbourne said there with regards to his eye checkups. The amount of people that come in to me and say, oh, it's quite empty, the waiting room, or it's not as busy as it was normally, before COVID. And I say it's just a testament to the way that we've had to carry out things. We've had to socially isolate patients because it's a safe thing for us to do, and it's the right thing for us to do in the current pandemic. And I think that patients generally look at this and think, oh, actually, this is pretty safe. I'm glad I came to the eye appointment, or I'm glad to come to my appointment for whatever condition they have, because not knowing that you have, or having a condition that is treatable and is not being treated is a terrible testament to any health service in any pandemic, because you've found a problem, but you can't treat it because we're worried about the pandemic in itself. And you're losing lives because of it. You're losing the ability for you to go about your normal activities because of it, which is terrible. It's absolutely terrible.
And you know what, David? What is interesting is that if I wanted to be facetious, I could have walked with my camera, opened my phone and said, I'm walking in the hospital. And there's nobody there. There's nobody. There was nobody at some point when I was going through. And I can see and I can understand now why that was so, because they're very careful as to where they put people or they direct people. So it's not as if to say the hospital is empty. It is just that they apportion it accordingly for people to still carry on with their different treatments that they need to make, isn't it?
Yeah, it is. And what I'm saying is we've got to find better or improved ways. We're always learning in this regard. Health service wasn't built for a pandemic. It's built to get patients through, to see patients in a timely manner and get their treatments afforded to them. And when things like this happen, it really does put the cat amongst the pigeons, because it's so difficult to try and afford that same level of care. And that's what you're finding with regards to the elective surgeries going up. But as I said, what we need to do now moving forward is try and adjust that, try and make, and we've done very well so far, but we need to get better, finding methods of giving people close to the same exceptional healthcare that we were delivering beforehand in and amongst this pandemic. Part of that is the exit strategy for COVID and having the time allowed and afforded for that. But in the meantime, we are coming up with ways of trying to deliver that care. We are coming up with ways of using telemedicine, for example, where we incorporate telephone consultations for patients over the phone. We use patients' ability to send pictures of particular rashes, for example, or lumps and bumps that they may well have, and make an interpretation that way. So we are getting better at things, but the times afforded to that is not great. So we need to move fast.
David, I'm laughing because I saw a video of a lady taking a picture of her particular place, and the husband came in and said, "What are you doing? What are you doing?" "It's my doctor. My doctor. I'm taking a picture of my doctor." I'm not going to talk to you. She was being naughty though, but it's for a doctor, you know what I'm saying? But I want to ask people this question, ladies and gentlemen, Instagram, YouTube, Facebook. Would you actually go into an hospital now if you have something which is separate and apart from COVID? You have seen and you have heard what we said earlier. There are over 225,000. It is at the lowest ebb. 225,000 people in England have now waited more than 12 months for routine hospital treatment. The question, David, is are they waiting as a result of the pandemic, or are they waiting because they choose not to go on, waiting for something to happen for them?
Brilliant question. I think it's a combination, and I can't give you the breakdown. But it's a combination, because we do find, unfortunately, that people will cancel their appointments because they're worried. And we're not in the business of forcing people to come into an environment, but we are here to try and make sure people are aware that environment that we provide for them is safe. It's going to be set up so that they can freely move around the hospital in a safe, when I say freely move around, but being the department where they need to be, in a safe manner, in a clean manner, in an environment that they can feel safe, because it is safe. And it's the test of time. We've got to test the time for this. We've put in these measures from the first lockdown, and these measures have become more improved over time. And it's the feedback that we get daily from our patients that make me realize that this is a safe thing. I had patients who would come in the same manner that Keisha's talked about there, where you come in, I didn't really want to come into this appointment, doctor, but actually, now that I'm here, I see that the environment's very safe, and I'm quite happy to come back. And that's like music to my ears, because we've encouraged people to come into the hospital. We wouldn't do that as clinicians. We wouldn't do that if we felt that there were a risk of picking up COVID to a greater extent. We wouldn't want to do that, because at the end of the day, we don't want patients picking up COVID and passing away through it on our watch. We want people to feel that we can manage their health conditions effectively, and deal with the problems at hand outside of that of COVID effectively. And I think we're doing that. And we just need to get better at it.
David,
Better at selling that message, showing that message.
Sorry to interject, Sylbourne, but just to clarify, David, you are aware that there have been incidences where people have claimed that they've picked up COVID at hospitals.
I think obviously, Keisha, there's going to be potential for picking up a virus in any way, shape, or form. But you're in a hospital for a given reason. You're not in hospital again, going to the supermarket, for example, where you need to buy a packet of crisp or whatever it is that people are buying. I'm not belittling the idea of picking up COVID at all in the slightest, but you're in hospital. So if people are in hospital, they're generally unwell. And what I'm trying to say is you can be unwell at home and not have any caregiver look at you, which is not the right thing to do. Or you can come into hospital and have the majority of people who would come into hospital would be fine coming into hospital. And the other thing to say is we don't know whether people would have picked up infections, whether that's in hospital or picked it up just before coming into hospital. It's a delicate matter in that regard. You've got people, unfortunately, who have diagnosed with COVID after having the vaccine, and again, the likelihood is that they were already asymptomatic for COVID. And then what we do is we say, oh, actually, maybe it's not we, but people would say, oh, it's the vaccine, but it's not. It's the timing of everything, and it's the affording of protection with regards to the COVID vaccination as well.
Can I just ask Keisha, before I go on to some of the comments from persons there, have your mind been swayed in a way?
I'm often persuaded by David, but at the moment I'm comfortable staying at home at the moment, so I'm not going to.
So therefore, if we're in a court of law, she would preface it by saying, "With all due respect."
With all due respect, David, I think I'm comfortable where I am. Yes.
But let's
at
hear
this stage.
I left this point here by Herbert. I think the access to information is allowing people to become overloaded with negative information. Do you think it's the information do you think that, Keisha, if you never knew of the cases of persons who contracted COVID in hospital, it would make a difference? But at the same time, people are contracting COVID everywhere around us.
I agree completely. If I hadn't heard of stories of people contracting COVID at the NHS,
yes,
I would probably have a different view on it.
I would say, Keisha, what proportion of people are picking up COVID while in the NHS?
David, I'm not interested in proportion. The fact that the NHS would be like the safest place. You're all clinicians, doctors, specialists, and this is happening there. Even one, that is a major risk to me, David. So
well, if I said that that's the same in what if it was the same in Tesco's, in I don't know, somebody going, say there was 10 people on your road. I'm giving a question here. If there were 10 people on your road and every one of those households, there was one person that went out of the household to go to the shop or went out of the household, and then 1 in 10 of those households, they got COVID, would you then say that everybody in that household had to lock down and not go out of the house? I'm just asking the question. I hope that makes sense. I'll ask it again in a different way. You've got 10 households. You've got 10 of your neighbors on the street, okay? 10 households, each is a nuclear family. You've got 4 people in each house. And in each of those households, including your household, there's one person that leaves that house to go to work and come back home. And then over a period of time, one of those households gets COVID. Would your answer then be for you to say, well, actually, all those households need to be on lockdown and not anybody in those households come out of the house because you want to reduce the risk of COVID? Is that what you're saying?
No, that's not the same thing still, David, because I would expect that one household to be, all shut in. I don't expect the whole street to be shut in. But I know.
No, but you're saying if you're going to hospital and there's just one case of COVID, then it's too much. That's what you're saying.
Well, to me, I see the hospital as in a different context. So I think, it's supposed to be a clean, COVID-free environment. Full stop. NHS. That's it. I don't expect.
So what you're actually saying is that Washington and Capitol Hill should have been safe.
Basically, something like that. I'm expecting the NHS to be safe. That's it. And the fact that I am going in for my health to the hospital, and that place that's supposed to be, that should have a higher standard, is somehow affected.
The last thing I will say on that is,
I think, if I could just add one more thing, David, to what Keisha probably is trying to say here, is that if you have a underlying condition already and you go into the hospital and you get COVID, that is your underlying condition plus your COVID that you're having to deal with. So maybe some people I think, okay, I'm going to hold off and wait. Maybe that's why the waiting list is getting longer, because people rather wait and see we get through the levels of the virus fall dramatically before they actually go to the hospital, because they don't want to have to deal with 2 issues.
All right, stick up
Yeah.
pin on that there. I just want to bring in sad for those who have to endure severe pain due to their ups, which have been cancelled, but some are afraid of picking up COVID, going to hospitals. Sad either way. That's what someone said right there. Herbert
Yeah.
said, of course, both. I think it's a bit of both. What he said right there. Lorna Foster said, I would be worried, as I would not feel completely safe due to the risk of picking up COVID, but each their own. Modern Allen says, people feel more comfortable going private, but good on those who have the money. So there's an issue about money now, because I think in Jamaica, they're doing some testing, and people who have money can get the testing done quicker than those who are going through the government bit. So is COVID also showing some inequalities at the same time, disparity, and is it racist? Is COVID now becoming?
Well, there's that, but when you talk about money, people have money, but people may well be dipping into their savings in order to.
Yeah.
It doesn't mean that it's wealthy people who are just going privately. It could be people from all walks of life that have got money stacked and saved for their pensions or whatever it is that they've got them stacked for future life.
Yeah.
I think that the only thing I was going to say is that hospitals are safe. In regards to the comment about going into hospitals and picking up the virus, you've got to remember that 80%, 80, I'll say it again, 80% of people are asymptomatic when coming into hospitals with regards to COVID. So, to screen out those people and make the hospital environment completely safe would mean that you'd have a one in, one out policy. Which again is not going to be the way forward. And the reason I was making the simulation to sort of Tesco's is because nothing's wrong with Tesco's, and I'm not advertising Tesco's, and I don't think it's a terrible thing to go to Tesco's. Just a supermarket, let's say supermarket.
I like
you're walking in and around people in a supermarket. You're walking in and around people in a safe environment in the hospital. So that's the point I was trying to make. You can be in and around anybody, anywhere in a closed space. But what we've done in the NHS very effectively is when you're coming into clinics, is that we have a set number of people who'll be coming into clinics through a footfall through that clinical environment to reduce the chance of any particular risk. We screen for temperature, for example, in our hospital to make sure that as a screen that you're not coming with a temperature. We ask a set number of questions, which wouldn't be asked if you went into a supermarket, whether or not you've had symptoms related to COVID. So the point I'm trying to make is we've made it safe. If you've got a health condition, or you have symptoms, come into the hospital, please, because again, I would hate for you to be suffering in silence outside of the hospital.
And I think as well, the hospitals are getting more secure in terms of their security, which is completely different, because I know before, if you've got somebody in the hospital that you need to visit, you could walk in and walk out, that sort of thing. These days you've got to have a code, and you've got a security guard there. You've got to show your letter. So I think they're taking the precautions that they need anyway before you get in there.
Yeah, I think it would be easier to get into a club in the 90s and early 2000s than it would be to get into a hospital without authorized access now, because of you need to be able to make sure to prove that you've got an appointment before you get through the door, and you actually have to come at the right time for your appointments too. So we're taking safety seriously, and I just want to make sure people are aware of that. We've got to make sure that people are seen for conditions outside of COVID.
And I must say, David, you can hear me, yes?
Well, you're quite quiet.
You're a little
there,
bit vague.
I got quiet again. Quiet. Okay, let me just do something to make myself not quiet. They did ask me these questions though.
You gotta turn your volume
still
up.
Quiet, still quiet, Sylbourne.
That's better.
Yes.
They did ask me the question before I came, a checklist. Have you been isolating? Have you got COVID? Blah, blah, blah. And if I had it, I wouldn't be able to go, So those questions were checklists. They were checklists at the same time when I went.
That's good to know.
Yeah. But Herbert said something here, which is crucial. 1917 vaccination carried out. I don't think there are major problems. I don't think there are major problems. Cholera vaccination carried out, not much problem. Polio vaccination done, no problem. Ebola vaccination done, not much issues. Now, it's easy for Herbert to say, David, but Herbert, were you there really at that time? But nevertheless, is it a fair statement that Herbert is actually saying? Because all of this we have been through.
Yeah, I take that as a statement of people taking vaccinations. I think that's the point he's trying to make.
Yeah.
And I think I touched on this last week when I talked about people who have taken prior vaccinations for other ailments and not had a particular issue taking them. And whilst I see people's reservations with regards to taking the COVID vaccine, at the same time, we've got to realize that they're likely to have got a TB scar on their arm at the same time as saying that they particularly don't want to take the COVID vaccine. And but I've got to listen to people, and we all have to as people within the health profession, and also as friends and families. If people don't want to take the COVID vaccine, it should not be forced. I don't see a reason and rationale to doing that. But you've got to realize why you're taking it, and the benefits that it's going to afford to you as a person, and to your family and loved ones. And I'm sure over the course of time, we don't all want to be stuck inside wondering and worrying about the idea of getting COVID, because fortunately, unfortunately, that we all want to fortunately live a long and tested life. But unfortunately, with that comes the idea that we will get and develop health conditions, and those need to be looked after in tandem with a health provider. And so we need to get out of the house for many a reason. And being in the house is not going to be great for your mental well-being, for your social well-being, and also for your physical well-being over the course of time. I think we're built very well as humans. We can stand the test of time for a prolonged period of time, walking towards that cliff edge very slowly. But at the same time, once we get to the cliff edge, we're going to need help. And to reduce the chance of going to the cliff edge, we need to get mobilizing and moving, and get exercising and get the heart rate pumped up as well. Think about all those days you spent on the playground, playing cricket, playing around, running after
David,
people.
If I could just interject slightly there, because we've been talking quite a lot about living with COVID and how we overcome COVID, but it's just a thought that comes to me in terms of what we define as normal lives, going back to what normal lives is. And it's just something that Keisha mentioned earlier about being at home, and she could just order from Amazon. And I'm starting to think now that going forward, even after the lockdown, people wouldn't be really going back to the normal life, if you want to put it. The other day, I wanted to do some shopping, grocery shopping, and I just went on Uber Eats, and it was delivered in 20 minutes. So I'm thinking to myself, going back to what we define as, rushing out to the shops or taking the train up to central London and all of that is going to be completely different. And so I think we're going to have a very unhealthy nation. We're going to be moving away from COVID to obese or something like that. So I'm just,
Well, I like the walking, and I think it's still good for people to walk and get out there, and you can be fit same way. I still like to go to Tesco's. I go to Lidl's. I go to, and it's so funny. You still see those guys in Tesco's and Lidl's, those supermarket staff. They are there diligently. So we're just good mates, man. Somehow they're immune in some way. They got some immune powers. You know what I'm saying? But we have to keep going there. We can't run. And Keisha, you hear what the man say. You must hear what the man say.
Herbert, I do take what David's saying on board. I think he's almost slightly convincing near there. But
okay,
well, that's a win. I take that as a win.
I take
that as a win. Let's stop. I take that as a win.
No, but we have to remind ourselves we're still in a pandemic. So the likes of Sylbourne say he's going shopping unnecessary. You don't need to go out the house to do shopping unnecessary when we have Amazon these days. I don't understand that.
Amazon has made so much money off of us. So much money.
We need to go out of the house.
The guy who owned Amazon made so much money that he don't know what to do. He had to resign. He had to resign because he doesn't know what to do and just sit back in my house now and just be executive chair and just sit back. He doesn't know what to do. He made so much money, David.
You missed out a big point there. He made so much money. He had a divorce, had to pay for the divorce, and he still resigned. That's some serious cash. That's some serious cash, and that's not allegedly. That's fact. So you can fact check, but that's some serious cash. We've got to get out of the house, and I'm a great fan of Amazon, but we've got to get out of the house. We've got to get moving. You've got to get that psychological well-being in tip-top shape. You've got to socialize. You've got to meet people. This all has to be done in a safe fashion. I keep saying that, but we've got to get out. You've got to see people, and physical well-being is crucial. We you know what? I think we value. I'm going to speak wholly here. I think we value wealth over the health. Okay, we talk about making money, living to make money, paying the bills, all the rest of it. But you put the back burner of health. Put health on the back burner. Sorry. Yeah. And then it's when it's time to really think about health, it's you're not really taking care of it. And I think that by having COVID now, I guess, put us in a position where we are reliant on other services like the Amazons for delivery, and can get takeout meals easy. And I'm not saying they're all bad things, but I just think when we incorporate that more into our life, I like what you were saying there before about the fact that it's going down the line of obesity, unfortunately, and that's then we're going to have clinicians in the hospitals waiting for people to come into hospital with all these ailments. And
you're obese. There we are. So therefore, what you're doing now, you're making it more for you to go into the hospital, man. You guys, But David, anyway, the next thing is China. I saw something whereby China is having some war with the UK. China banned BBC World News from broadcasting because of this whole thing regarding where the war. I mean, Trump always says Chinese virus. I mean, they're the twins. The twins come on and say you get a discount. What we call it, Chinese virus. Why? It come from China.
Earlier with Sylbourne, I thought they got somebody. So not they. Somebody. I'm not going to say they. Somebody had got to your mic because it was being cut off. So I just wondered if that was the same kind of.
I got cut off. Can you hear me?
No. Well, I could hear you, but you were very faint with your microphone. So I wondered whether something was going on.
I didn't say nothing against Rishi Sunak. But on a serious note, though, I mean, what they says regarding China is that China's banned BBC World News from broadcasting on its territory, according to a decision announced on Thursday by its broadcasting regulators. China's criticized the BBC for its reporting on coronavirus and the persecution of ethnic minority Uyghurs. So this is the whole thing, because right now they're actually trying to now get into where did COVID come from. They're now looking to inquire where did it come from. Was it some animals, as they say, from there's a movie actually going around there called Pandemic or So, where it's from the animal. Is it that, and people are actually saying, is it a pandemic now? Are we still in this pandemic? So now that, as the fact that they're going into the origins now of this to find out where it came from. Do you guys believe it came from China? Or it came from a lab in the States?
Well, I think it comes from China, but I don't know. I mean, the thing is, when this the virus started, everybody was saying it come from Wuhan, China, and it was at a fish market in China. So I think that's already settled on people's minds that it actually come from China. I think the situation there is that China is on this propaganda warfare, if you want to put it now. They're trying to transform the image, and so or the story that it's all come from them. Of course, Trump was big on saying, it's the China virus, it's a China virus. So that sticks very, very well in people's minds. And so, but for the Chinese now, I mean, they've already come out of the virus, the situation, and they're actually moving forward. And of course, they don't want this to be stuck with them. They want to have absolutely nothing to do with it. So I think that's what the situation is here.
And that is if we are really hearing the news from China. That is if we are really hearing the right news from China again at the same time. Because they said the news is very controlled coming out of China. It seems like everything is gone back to normal in China, while the whole world is in panic. So hang on a second. How is China flourishing while the whole world is going on like that? That's a big question again. Or is it fake news?
Well, I don't know. I can't comment on what's coming out of China, but I can comment on essentially what's happened with regards to the press. And I think it's, as Herbert just put up there, there's obviously been issues regarding to Ofcom allowing the government of, well, not government, but the Chinese broadcasting to occur in the UK. So it's kind of a tit for tat that's going on. But we've seen that over the past few months, there has been questions raised in regards to Chinese involvement in persecution, and so I think those kind of questions, alongside the origins of COVID, obviously throw into question the relationship that the UK has. There's the whole issue regarding 5G as well, and the incorporation into the UK infrastructure. All of these things, I think, haven't helped in the relationships between China and the UK, and actually China and the US as well. That relationship seems slightly fractured, and it doesn't seem to have improved any, given the new president either. So, when you look at the situation, these fallouts will have obviously occurred. I guess you have to just watch the space and see how the relationships fare for the future, because whilst this this news issue is a big issue, there are still trade deals that obviously have to be undertaken in the next few weeks, months as well, especially from the UK's perspective in regards to Brexit. So we just have to watch carefully and see how the relationship pans out. But there's no doubt that this piece of information in regards to news, it hasn't helped or won't help in that regard. Whether it's the wrong thing, who knows? I mean, the UK, I can say from my experience of being in China, the BBC was broadcasting sort of international hotels as opposed to being broadcast to the nation at large in China. And that was me just on direct questioning of people when I was in China. So I think that it is an interesting development, but I think we want to see what happens in regards to the future.
Okay. And and moving on from that, we want to try to find some different stories. Well, there's one person who have got some success. Duchess of Sussex has welcomed her High Court privacy victory. So that's some nice news away from everything. Merkel has won some news. Are you guys happy for her? I mean, she's getting all this hit back a lot.
Yeah. Well, I'm happy for her. I'm a big fan of the Duchess, and I don't think the Duchess and the Prince, still Prince Harry, can do no wrong as far as I'm concerned. They've made the right choice to move or relocate to the US. I mean, and that's because of the backdrop of the amount of negativity that certain press, newspapers, outlets have been saying or reporting about the Duchess, which is really sad because as a Black ethnic minority myself and witnessing these in the news, people saying certain things about her, which is just completely derogatory and shameful. I mean, in a sense, you begin to see the mindset of certain individual within the UK, and some people might think, okay, the UK is not racist, but when you see certain statements actually being, stated or expressed, even on the commentary, so you have the, certain news outlets write their reports, and then you have the commentary, and people and the stuff that they say. It's really concerning, and people seem to forget that the Duchess, for example, whatever is being said, they affects her, as an individual, because they automatically she's thinking, oh dear, this is what these people thinks of me, and I'm so glad that she finally, this is I'm hoping one of many successes to actually finally get victory. Because she's entitled to her privacy and she's entitled to be respected, and this just demonstrate that hopefully there's a turning in her favor.
So the background to this is regarding the handwritten letter to her father, which the press got hold of following marriage to Prince Harry. And in judgment, Mr. Justice Warby ruled that the publication of a letter, which is described as a long-form telling off, was manifestly excessive and hence unlawful. And it wasn't a cat that made the judgment, or so it was. I think a judge.
Yes, Sylbourne, that's what I wanted to. I'm glad you pointed out, because what I'm trying to say is that, given that letter was published in its whole entirety, people obviously started getting this perception about Meghan being, somebody who don't get along with none of her family members.
Yes.
At all. A completely spoiled brat type of person and all that kind of thing. And all this, and it's because of what the press put out. And I'm forgetting there are two sides to every coin, yes. and this actually affected her. And I'm so glad that she took the steps to actually to take it to court, take the matter to the High Court.
Yes. Well, what can I say? She done a bit, and it takes away some of the world's thing out of the COVID thing to show that life still goes on. I mean, is life going on for a lot of people at the same time? Do you believe that people are stuck at this moment in this time warp in a way, and they cannot move forward? As one of the things that me and Coach Chris Brown, what's your thoughts on that? Do you believe people are stuck? They're not moving forward, things that they want to do? Are they?
Yeah. Well, is it the health secretary today was saying about people going on holidays and defining what a holiday is. You're not meant to go abroad, or you're not meant to. Your staycation has to be in your house, not somewhere in Bogner region. So either that sort of thing. You so really, people live to me is at the standstill. People, British people, a lot of people like to book their holidays, their summer holidays somewhere to Spain or the Caribbean or whatever, and people are told, well, really, don't book your holidays. Matter of fact, don't even go outside London, or don't even go to Cornwall or anywhere. So it's just really, really hard for people to plan anything going forward. So yeah.
So people are encouraged not to go forward.
Yeah, absolutely. Because for some reason, although we've vaccinated how many million people, over 15 million people now already, and we're in a really good trajectory in terms of the vaccination, people are still told don't do anything yet. You're going to be wearing your mask for a very long time. So it's really hard for people to plan anything.
David, just on that point that Keima just mentioned a while ago about the vaccination, I see lots of people that are taking pictures and putting up of them taking the vaccination, and I think they said that the government is actually hitting this target, isn't it, regarding vaccination now? But the key thing which is coming through is that is the vaccination going to be protecting people? Do they still need to wear the mask? What is the vaccination for? I'm sorry. I'm not sure that's the question. But people when they ask certain question, they say, why are we taking it?
Sure. So what does a vaccine do? Is that your question?
Yes.
Okay. So the vaccines essentially have historically been there to reduce the chance that with you becoming unwell with the condition, that it reduces the chance that you're going to become unwell to the extent that would allow you to go into the hospital and need to have life-saving treatment, which I want to just touch on as well just for a moment.
Yes,
I think the news reports today positive, the spirit of positivity, you can call him as Dr. Positive if you want. Spirit of positivity, there are improvements in the treatments that have been afforded for people who have the unfortunate condition of COVID, and then means that we can reduce the likelihood that they will need to have either life-saving further oxygen treatment or admittance to ICU. So that treatment is an arthritic treatment called tocilizumab, and it's used with some steroids as well to try and reduce people's morbidity in hospitals. So that's really good news that's been circulated in today from studies. But going back to your point and question was about the vaccination. The vaccines are, I say, there to reduce the chance that you will essentially have a particular problem of needing hospitalization because of picking up COVID. So it's your body's way of trying to fight off the infection to a greater extent than it would have had without it. The secondary thing here is that with regards to vaccinations, is we're looking at the data to suggest whether or not it stops the transmission. And there is good news that's come out recently in regards to that as well. So the affording for people to reduce the chance of transmitting a virus that they have to a secondary person. So it protects you and it protects people in and around you. And at the same time, that at the same time, people need to have an uptake with regards to the vaccine in order to sort of achieve the goal, which is a reduction across the board. So that's the reason that the vaccination program exists. So quite obviously, if people do not take the vaccine, then those people are going to be at more risk. Now, at a certain point in time, what you have is a number of people who have had the vaccine and a number of people who haven't had the vaccine, but there's less of a reliance on everybody to take the vaccine at that point in time. And I can't give you that definitive figure. I don't think we know that definitive figure. And to get 100% uptake of anything is difficult and challenging. And that's why the government has really pushed the idea that we should all be trying to take this vaccine, because at the end of the day, if you take the vaccine, the risk of you having a condition related to COVID that's going to put you into the need of becoming a candidate for ICU, the intensive care unit, is going to be reduced by doing so. So the reason for not wearing the mask, between now and then is because you still can transmit. You still can have the ability to transmit, and you have a time where the tolerance level of you being able to fight off the infection is still necessary. So it's not like you take the vaccine today and you're protected today. It takes a few weeks for you to get that infection or to be able to fight off that infection adequately. And remember, from the studies that we have, that there's a reliance at this moment in time. The data supports the idea of having or needing 2 vaccinations within a period or window. Now, the UK elected to extend that window, but at the same time, the window for the studies from Pfizer, for example, was a shorter period of time. And the fact is, there's 2 vaccines to reduce the chance, again, of you falling very well with regards to COVID-19.
You know what I'd love to know is this: with the advent of the vaccines, I know there are 7 vaccines which are out there now, and they're all jockeying because they have gotten to what I would deem as an Amazon moment or an Apple moment, whereby they're raking in the money, these top guys now. The big question is this: is it because of the vaccine why it is coming down? Or is it that people have been doing well, isolating,
Yeah. Very good question.
Because isn't the test going to be again when we open up?
That would be the greater test with regards to things. But I think that what we do know is that the studies were running alongside when countries were open and closed for business, if that makes sense. So the studies gave us that data to support what was going on. So some countries may have been in a semi-lockdown, some countries were in greater or lesser lockdown. So we knew from those studies that we were able to reduce the chance of people picking up COVID-19. You're right, we're still in a period of isolation from one another, but at the same time, the vaccine will work. The effectivity will be put to the test when the lockdown restrictions will be lifted. And again, in direct answering sort of to regards to why people are still wearing masks is because not everybody has been vaccinated in the country. We're still only at 13, well, I say only, fantastic effort, but we're at 13 million. And so, again, the tolerance level to build up to getting to where we want to be, we've got to take those 2 vaccines from the studies, so we're not at the level that would allow us just to walk around freely, and not everybody's had the vaccine at the moment. So that I hope that answers the question.
Yeah, more than that.
David, are you suggesting that once everybody's vaccinated, then it's likely that we don't have to wear masks? Because I think the question people are wondering is, people are taking vaccination, but are told still to take the mask.
I think in certain circumstances, masks will probably, and this is my personal feeling, I'm not speaking on behalf of anybody but myself here. I think masks will still have to be used in certain areas, especially that in health. I can't see that going out the window anytime soon. But in other circumstances and other circles, I can see that probably won't be as big a necessity. But until we get the data to support that as an option, then we have to follow the guidance.
All right. We're out of time now, and we're going to be continuing this subject over and over for the next months or so. But let's just.
I would just say with the question that's there, because it's just there because we can't put it out there and then not answer it. In regards to the penicillin allergy, I think Lorna needs to speak to her GP. She needs to talk to them about the risks of taking the vaccine and the actual exposure to the problem of allergy that she had. So it depends on the type of allergy, and I can't give any medical advice on any particular forum, but my advice would be to see her own GP and discuss those risks, those real risks, with her GP, who will be able to give her better guidance as to the safety of taking the vaccination.
Yes. So might as well just carry on, David.
There's another one here for you, David.
Yeah, sure, exactly. So I don't think that will be wholly what will happen. I think that as I said, certain circumstances will be afforded to still need to wear the mask. But again, I'm not speaking on the advice of the government. I'm just thinking about the scenarios which will probably pan out. So certain areas you still have to, and certain areas you probably will be more lenient in regards to mask wearing. But I can't see that just disappearing straight away, because remember, we've got to be able to vaccinate the whole country over. And the small thing I will say is that there's obviously variants that have popped up as well, and we're still getting to grips as to of how effective the vaccines we employ currently are. So that's another reason why I would be hesitant in saying that the direction is liberation of masks for everybody post the vaccinations this cycle. And this is going to be a cycle, by the way. I can't see there not being updates in regards to the vaccinations.
David, can you see the questions?
I can only see some questions on the side. Yes.
Can you see a question there? Can I put it up there?
A question? Which one?
Oh yeah, you can put that up. I don't mind. Put it up.
Yes.
And the answer to that would be no.
That's a good question.
The answer to that, Michelle, would be no. At the end of the day, I'm a person who speaks passionately with my patients. I think that one of the things that I pride myself on is having a good level of consciousness.
Yes.
I speak to my higher power, and if I can go to bed and sleep consciously at night, then I'm quite happy. Pay isn't the thing that dictates what I say or what I do. Quite obviously, pay dictates a lot of the things that would be afforded to us during the course of our lifetimes. But I'm a person that speaks with conscience. If I can't say something with the wholehearted view of something, I can't speak on the topic, and I'll just afford not to talk about it. But on this topic alone, I think I'd be silly not to speak to my community about why I think it is the way that we should do about things. I'd be silly to even think about enforcing it or saying you should or you must, because at the end of the day, people are afforded choice and free thought. But I've got to speak on my truth, which I hope you guys accept. And my truth is what I've said from day one. We've got to respect COVID-19, but we've also got to think about other conditions which will affect our community to a greater or lesser extent. And we've also got to think about protecting yourself and protecting your loved ones. And the way that I feel that that's achieved is by taking the COVID-19. But also the biggest thing is getting into our hospitals and seeing us because it's safe.
And I can just sort of support David on that position as well, that David would not be on the show if he was fake.
But still, what I was going to say is that let us hold off on that questioning until he gets appointed as the government doctor, and then we work out whether the conscience still remains.
I tell you one last thing. A wise patient said to me when I was a very small junior doctor, and then I saw her about 6 or 7 years later in the same hospital. She said, "Dr. Burton, don't ever change." And I've taken that as something that I will never ever do. And when she saw me as a consultant, I told her I was a consultant, and she said, "Okay, are you still doing X?" And I said, "Yes." She said, "Okay, you haven't changed, and I'm not going to change. There's no reason to change." I said it's the level of consciousness that allows me that flexibility to talk to you about my conditions, like I'm talking to you about this today.
Yes, and for the record, David is my by default GP.
Not qualified as a GP, but I'm an ophthalmologist. I'll give you some medical advice.
Whatever the doctor said to me, I call up David. I said, "Dave, what do you think, man?" actually, no, I'll come back to you because I said something to the ophthalmologist yesterday, and I said, "I got a friend." I said, "Okay, speak to him."
It's true. Anyway, it's always good to have a lawyer friend and a doctor friend.
Exactly.
Yeah.
But ladies and gentlemen, listen. Let me just show you something which is very special. And for those who are having Valentine's Day, this is what you should do for your special partner.
This year, get her the one thing she's been waiting for. The COVID-19 vaccine from Pfizer. Don't just be her somebody, be her antibody. Because the quickest way to the heart is a syringe. Inoculate yourselves with love. The COVID-19 vaccine from Pfizer. Not available anywhere.
Okay, well, ladies and gentlemen, that was something that it is for humor, I must say, and it's actually a joke, So I don't know anybody taking that serious. David, see how Pfizer is gone. This company is big now, man.
Well, the drug companies have always been quite big, but they've all had one common purpose in the past year, which is to try and get the world moving again. And
Yeah.
hopefully, this will be one way of achieving that, as well as people keeping safe, eating well, eating healthy, getting outside, physical fitness, getting up, soaking up what little sun we have in this country, and moving forward.
We're not going to be able to touch Trump today, but Michelle Clark just said, why is the government pushing this vaccine and not telling the public about good nutrition, eating right? Are they telling people that?
I think with respect to COVID, in the battle against COVID, what I would say is that somewhat you do need to eat right. Okay, there's no question about that. But there's always going to be a need to eat right, regardless of COVID. And so there have been public health initiatives to try and get people eating right, initiatives to think about minimum unit for alcohol, for example. And sometimes there's pushback in regards to that, because you've got to think about the effects or the ill effects that alcohol, for example, could have. Smoking, the things that they've done in regards to smoking and trying to enforce bans in public areas, and hiding away cigarettes behind the shelves without the packaging and all the rest of it. So there have been public health initiatives to address health concerns. So I can't say that, and those existed before COVID, and those will obviously help in regards to the battle against COVID. But we've also got to think about the things that we can do tangibly now to reduce that chance. And each part plays a role. But I think that the role that we have in regards to the medicines that are afforded to it are ways out of this particular predicament.
Okay, let's wrap up. 30 seconds. Keisha, what's your thoughts on the impeachment?
I don't know why are we doing this. I think I think it's just a trial that's going to just end up as a, if you call it like an acquittal or something, because based on what I know I should be quick, but based on what I've seen, I've listened to clips of it, and there's one of the impeachment manager, comparing the incident at the Capitol to September 11. I mean, it's like, I know it's a serious incident, but I think it's drastic, isn't it?
That's nothing. CNN compared it to Rwanda.
Well, oh my God! You see what I'm going with this? So I'm just thinking people be coming back. I was with the person until she started making that comparison. I'm like, where are we going with this? Seriously? It's almost like doing everything you can to throw every book you have at Trump. Okay. I think if we're going to impeach him, impeach him within context and not exaggerate the situation.
Okay, Keima.
Yeah, it's interesting. I think they're presenting at the moment new surveillance, new videos, and they're trying to persuade more Republicans. I think they need 16 Republicans to cross the line to vote with the Democrats. It's highly unlikely that's going to happen. I think they've got 6, which we knew they would have 6 because they've already voted in the Senate. But to get more than that, and people are beginning to wonder whether some of the evidence that they put forward, or some of the evidence, how genuine it is. There's that theory coming out now. I think it's a good exercise, but I don't think there is anything going to come out of it. And, the issue is, as well, it might just divide the country even more than unite the country. So that's the risk.
That's a good point there. And David?
10 seconds. 10 seconds. In the words of Maximus from The Gladiator, are you not entertained?
Of course.
Yes, that's the whole thing. And
we always, Sylbourne, we always like a courtroom drummer. So yeah, why not?
And the final thing what Keima said was crucial. If they really want to unite the United States of America, this is not happening. So this is a splitting. But anyway, still, that's the United States of America. Somebody came to me the other day and said, Sylbourne, Trump is this. I said, I'm doing my walk and talk, man, my motivational moment. I'm signed off America. Another person said, do you know what's happening in America? Man, I'm doing my walk and talk, motivational talk. Have you watched my video? You need to watch my video, man. That's what you need to watch on my podcast. Anyway, guys, listen, it was great. Ladies and gentlemen, Michelle and all the interaction on Instagram, Facebook. Thank you so much for this. It's always good, and I believe it's very informative. And share the video as well, because what the contents and the quality of discussion is always good. And we thank you so much, Dr. Burton, for actually giving us your time as well for this, and for people all over.
For free.
For the chief positive geezer, King of Kings, Lord of Lords. You know what I mean? Wonderful.
All for free. All for free.
All for free. All for free.
And the occasional coffee.
And the occasional coffee. Okay, so see you then. Good night, and all the
Good
best.
night.
Good night, everybody.
Don't let the bed bugs bite. Peace out.